And when we talk about homelessness and mental health, there are barriers there too. So these are some of the barriers. Lack of documentation. Oh, several times when an individual is transient, it's very easy to lose documents. Sometimes their personal items are stolen. Sometimes just in being moving from place to place, they lose IDs, social security cards, everything. So very often we start from scratch, helping them to get these items back. Lack of transportation. They don't have money. Lack of trust in service providers. And touch on this one, jail and prison sometimes serves as treatment facilities. We need a crisis response unit here in St. Joe County because we don't have one. And there are times when I really don't want to call the police, but I don't have a choice. And so sometimes what happens too with individuals who experience mental health disorders, when they have an episode and is on the street, prison or jail may serve as the treatment facility. And that's not rehabilitative. And when they leave, they're in the system and they just cycle in and out of the system. Lack of adequate treatment facilities, not knowing where to go to be treated, embarrassment. Steve mentioned that. Self-consciousness about their appearance and hygiene. I don't want to leave home if I didn't take a shower or if I didn't do my hair. When I had this presentation, I was like, I gotta make sure I look presentable. So imagine someone who may want to go for services, but they feel so insecure about how they look. But how can we remove these obstacles? I'm trying to rush because I know I want to let Steve answer the questions. We can build a trusting relationship. I love Carl Rogers. And so I quoted him here where he said, in my early professional years, I was asking the question, how can I treat or cure or change this person? Now I would phrase the question in this way. How can I provide a relationship which this person may use for his own personal growth? So we want to build that relationship, right? Steve is a comedian. I love to laugh. So we have that relationship. He's always making me laugh. And so I have to build that relationship with him. I can't come with the attitude to Steve and expect he's going to trust me or even ask me to help him with anything. Be intentional to address individuals by their given name. Super important, because a lot of the times their sense of personhood, not anybody can take that from you, but they feel as though it was taken because they were called homeless and they were called all these things, right? So you want to make sure that you replace, you speak to that sense of personhood by saying Steve, by saying Tamara. Smile. A smile or a kind word can be a simple way of replacing at least one negative experience that this individual may have. You're swapping out the bad for the good. You want to use destigmatizing language. Many times when I'm talking to the guests that we work with, they refer to themselves as homeless, and I correct, and a person experiencing homelessness. It may seem like a small correct, but it's huge. That should not define who you are. Ensure as much as possible that the individual's basic human needs are met. When we have an individual coming into the building for an intake, for example, you want to make sure that that person has something to eat. Hey, did you eat for the day? Because I can't sit down and do a 30-minute intake with you on an empty stomach. I got to make sure when you're working with individuals experiencing homelessness that those needs are met. You want to take a multidisciplinary approach. I'm a therapist, can't do it all, right? I need the medical professionals. We need case managers. We need psychiatrists. We need the Oaklawn recovery coaches. We need real services for the services they provide. We need all of that in order to provide a holistic service for the individual. We want to address those administrative barriers. So you want to make sure that you're helping the individual complete. If they need health insurance, you got to help them with that. If they need SNAP benefits so they can get food stamps, you got to help them with that. I can't be, so Steve, tell me what's going on. And I'm completely ignoring those basic needs. Increase access by offering pro bono services to a local shelter or community organization. So you want to bring those mental health services to them. We just recently started, so grateful for Oaklawn recovery coaches, a recovery program here where we bring the services to the guests. They just have to walk to the building. They just have to walk to the room. We have pizza there, everything. Engage in outreach efforts, particularly street outreach. Very often we may sidestep that piece, right? But research has found that such programs are very successful when workers establish a trusting relationship through continued contact with the people they're trying to help. So be consistent and use your voice. Lobby for local crisis response units or jail diversion programs. Right. And you got to also, like Steve was sharing about the housing crisis, talk to friends that may help, talk to the South Bend Housing Authority, see how you can get on board, probably be a landlord, encourage your friends, increase community awareness on mental health. You want to, and homelessness, you want to break those stigmas down. You want to share the knowledge that you have. Sometimes people stigma sometimes arise from fear and from these images that the media sometimes perpetuates. You want to make sure that you do your part to raise your voice, like Steve did, like I did, to kind of let people know, hey, my name is Steve, right? And anybody could have the name Steve. Homelessness does not say, you know what, I'm just going to go over here. Right. It doesn't go over here, you know, I'm going to go over here to Steve only. I'm going to go over here to Tamara. It doesn't, it can touch so many lives. So that brings me to the end. And I said I wanted to give 10 minutes, but just be a little under that. And I'm going to read this because I really want to give the time for questions. Again, Carl Rogers, when the other person is hurting, confused, troubled, anxious, alienated, terrified, or when he or she is doubtful of self-worth, uncertain as to identity, then understanding is called for. The gentle and sensitive compassion offered by an empathetic person provides illumination and healing. In such situations, deep understanding is, I believe, the most precious gift one can give to another. And so I thank you guys for just being here and giving us a voice to kind of speak on this topic. This is really dear to my heart and I can talk about it forever. So I really want to end with saying, homelessness doesn't discriminate. It does not, and it is hurtful, like one of my clients shared. And just being a listening ear, just giving somebody a voice, just having that empathetic understanding, like Carl Rogers said, is one of the most precious gifts you can give. And then all the other solutions, some of them that I mentioned there, just doing one thing at a time can really make a difference.